So I will just repeat the scenario because the scenario is a 14-year-old child, Abdullah, and he is a known case of asthma coming with frequent exacerbation. You have to take history from the mother. Your time starts now.
Hello, good afternoon. I am Dr. Asma, one of the child doctor in this hospital. I believe you are Abdullah's mom.
Yes, doctor. Good afternoon. I'm Abdullah's mother.
Thank you, mom, for sitting with me to discuss about Abdullah's condition. Can you tell me what are your main concerns now?
Doctor, as you know that he's already on medications for asthma, but I feel like he is not getting better, and I think he needs some more medications to control his symptoms because every now and then he's coughing and he couldn't perform in school. Whenever he starts running or doing any activity, he feels like short of breath.
I can understand it must be very difficult for you and Abdullah. Okay, since then you are noticing that he is having this frequent coughing and he's not
I
improving.
think it's not good good for a couple of months now, or maybe for 3 to 4 months.
Okay, can you describe more about her cough? How is the cough? It's the more at the night or in the day or
So no need to give any like prompt, is it there? So you told
okay.
about, can you describe it? So, doctor,
Mm-hmm.
suddenly he starts some coughing bouts, and generally speaking, like sometimes it's associated with breathing difficulty as well. And I'm thinking like maybe towards the end of the day, he gets more symptoms and he gets more cough and breathless. And sometimes he has to wake up at night, and then he couldn't lie down flat on his bed as well, especially when he's sick. So he needs his pillow to be like head and to be up as well. Generally speaking, like it improves sometimes, like after going some nebulizations or inhalers. But now it's not getting better. Like it's getting very difficult. His sleep has been disturbed as well. He's not able to perform well. And generally speaking, in the school, after he gets like this problem in the night.
Mhm. So, can you remember almost how many times in the night he wakes up in a week or
I think he's been like 2 to 3 times at least.
okay, I'm so sorry to hear that. And cough is you can notice his cough is dry or he's making some phlegm also.
Sometimes he is spitting, but mostly it's kind of dry cough. But sometimes after nebulization, he spits as well, some phlegm.
Yeah. And when Abdullah was diagnosed with asthma,
Yeah, doctor. Actually, he was diagnosed like 2 years back, and at that time he was started on with some medications, and yes.
can you describe in detail what happened at that time and how where he was diagnosed and he was at that time hospitalized or
Yeah, I exactly can't, but actually we were in some other place, like living there, and there were lots of construction going around as well when we shifted in that house. I'm thinking like maybe he gets it from there because he gets frequently very sick, and one day we had to rush to the emergency. He has, and then they told he has some asthma and allergies problem that has worsened, maybe I don't know, and he was admitted in ICU for 2 days, and after that he was put on the steroids as well.
and what medicine he's currently taking?
Yeah, so he's put on the inhalers currently, and he's using it like the blue inhaler and his steroid inhaler.
Okay. And it's using by himself, or you are taking care of that is his medicines?
No, no, he's been using it himself now.
Okay. Is this using with any special device or without?
Generally, he's at school, so he doesn't use it with a spacer.
Okay. And what have you ever met the asthma nurse about the inhaler technique?
Yeah, the asthma nurse trained him, and he's following the advice as per them.
Mhm. And have you been checking the his maintaining any diary for his have you have
Yeah,
Abdullah
he
using
is
any
actually
device?
he is like, I told him to do, but he's kind of like not that much careful about it. So I am maintaining his diary and regarding the symptoms.
Mm. And did you remember in the last year how many times he has to take the steroid?
No, I don't remember exactly.
Oh, okay. And then has any lung function tests were done for him?
Yeah, it was done around like 6 months back. At that time, it was okay.
And now this is cough for 2, 3 months. Is this associated with any fever?
No.
And you notice any weight loss or weight gain?
Yeah, he is like a pity, I don't know, but he's like a good weight as well. And I think he has gained a bit more weight as well. I think, I don't know, but I think he's gaining weight and he's quite bit, at that age, a teenager and having asthma. So he's kind of like
Mhm.
on the higher side on the weighing scale.
Okay. And anytime you notice that he's coughing and his color change to blue,
No, 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 that this situation never
and
happened.
he complained any chest pain or any breathing difficulty.
Yeah, at night when he's coughing a lot, when he started having this bouts, then he had a complainer because of the coughing. I think he complains like frequently chest pain and breathing difficulty as well, but not routinely.
Mhm. Anytime he complained of his heart is racing,
No, generally not.
and ever he fainted,
No.
and as having throwing frequently,
No.
any rashes in the oral cavity in the white,
No.
any concern regarding his poo or pee. He ever
Mm,
complained of that?
no, doctor.
Okay. You notice his increase in the tummy size.
No.
Okay. Okay. And is any complaint of the headache?
No.
Any concern regarding his vision and hearing?
No.
Okay. And any recurrent ear infection,
No.
uh, runny nose, cold symptoms?
Yeah, that he gets. I don't know. He has some kind of a rhinitis issues as well.
And his skin rashes he has?
Skin rashes. Yeah, doctor, he
Rashes
is
on the body?
suffering from very bad eczema as well.
Any lumps and bumps in the body?
No.
Okay. Any he feel
So I told
mold,
you he
mold
is
or
suffering. He's suffering from a very bad eczema, and then you move on to your
uh-huh.
questions. What you should do in response.
That's what has been done for that
And
eczema, particularly.
yeah, I'm so sorry to hear about that. So, like, you have
Uh-huh.
to show some thing. Na? She said it's very bad eczema, and what has been done. Yeah, doctor,
Yes.
the multiple emollients has been prescribed to him, and I don't know. Sometimes it gets better, and then it's worsens as well. So it's kind of a waxing and mending picture for him.
So sorry to hear that. Regarding the other than the asthma, any other condition he is suffering from? He
Mm,
underwent any surgery or anything significant in the
No,
past?
actually, he's not suffering from that, but I think he has a problem is that because regarding the food, he sometimes complains of, I don't know, some kind of a bloating, and then he complains of that after eating some spicy food, he gets a bit of more like maybe a feeling of a burning sensation as well in the chest. So that is the problem that's recently started. He's telling me about it.
Yeah, can you describe your pregnancy with Abdullah and his birth?
Mm,
Us try to keep empathy, okay?
Okay,
Empathy
okay,
every place, okay?
okay.
okay. So, okay. Right. So, no,
Uh,
no. When he was born, he was fine. So you have 4 minutes now. When he was born, he was fine, and he was born normally, and we were discharged the next day. There weren't any issues.
mhm. And his newborn screening was done,
Yeah, that was normal. I don't remember any problems at that time or like that. It's been long time back as well.
and I can understand. And what about his jabs?
Yeah, he received his routine jabs, and
Any extra jabs are
yes, yes,
advised?
yes, yes. He received some influenza and COVID vaccinations as well.
Okay. And other than this eczema, he has any, you notice any other allergies to any medicine or any food?
He's allergic to strawberries.
Okay. And have you ever met any allergy doctor or any allergy test was done?
I think I exactly don't remember, doctor, but I think he has done some skin tests for him as well at the beginning.
Yes. And as you have, what about, can you explain his diet?
Yeah, doctor, he is like, as this teenager groups like that, and as he growing older, he just wants to be like more eating outside, and I can't restrict him as well because sometimes he has kind of a tempers and moods as well. So he's more on junk. So I think that's the reason he's gaining weight as well, and the issues of, sometimes he feel like burning and heartburns as well.
That I can understand. Then that he's 14 years old. Have you any concern regarding his puberty?
No, I think his voice and his that sounds like he's starting his puberty and sometimes his mood swings as well. So I have noticed some changes he's going through.
Okay. Can you describe your family?
So yeah, me, my husband, and we have two other kids as well. So yes, and he's the eldest one in the house.
Anyone in the family is having asthma or any other similar condition, allergies?
Yeah, doctor, I have the problem for the eczema. That's it. And I have a problem since like early on with the problems with eczema. Otherwise, none of them.
Anyone in the home is smoking?
No.
And by any chance, Abdullah has ever smoked?
No, no, doctor.
Sometimes he's the teenager.
No, no, no.
Okay. And can you describe your home?
Yeah, so we live in a three-bedroom house, and that's a good area now. Thanks God. Previously, it was like lots of construction going on, but now it's a better area, and it's good ventilated as well. And we are avoiding, as you know, he's allergic to that. For him, we are not keeping the pets in the carpets as well, though he loves pets a lot.
Okay. And so how is he's in school?
Doctor, there's a lot of exam stress for him, and he's good in academics otherwise, but I don't know, he's very much like the competition is very high, and sometimes he's like that as well. So, yeah, he's trying to cope up with that. He's good in academics.
That's great. And how about his relationship with his friends in the school?
Yeah, he's lots of friends, and otherwise, he's doing pretty well.
That's great. And you have any emergency management plan with you for if in case this condition worsens?
Yes, yes, yes. We have given provided it by the GP and the asthma nurse as well. So regarding the red flags and what we can do in that situation.
Any kind of social support you are getting that he's having this chronic condition Abdullah is suffering from?
Sorry, can you repeat your question?
Any kind of social support you are getting because Abdullah is suffering from this chronic condition you need to.
No, actually, my husband is earning well, and we didn't require anything else apart from his all the medications have been provided by us.
Okay, and how is, as you already told, that is affecting its school, and how is this asthma of Abdullah is affecting your family, and can you describe more?
I think that is more impact on him because at this age, and he's the one in asthma, and he feels like that he has to carry his inhaler and everywhere, wherever he's going, because in emergency situation, he was told that like he has to use his blue inhaler. So that's why he has to carry it everywhere, and he feels shy about it as well. Sometimes he gets it into it like nobody else is suffering from this, and I have to avoid a lot of things. And he loves pets as well, so he can't interact with them. So I think he's getting a bit more, but we are there to support him as well.
So sorry to hear that. One more thing, forget.
Your
Um,
time, anything else? Done?
okay,
Done.
I completed.
Okay. Okay.
Get,
So you
getting.
took 2 minutes, 2 minutes extra to summarize your case.
I take history from Abdullah's mom, who's 14 years old, known case of asthma that was diagnosed 2 years back. And that time he was hospitalized and was admitted in the ICU. And diagnosed was with asthma, started with inhalers. And now he's presented with the repeated exacerbations for last 3 to 4 months. His asthma is getting worse, and he's using the inhalers on his own. And mother is feeling that sometimes uh, not he's avoiding to take the inhalers because of his age. Uh, and he has having also having bad eczema since childhood. And there is recent weight gain also, and uh,
So,
family history
Asma,
of allergy.
try to summarize once more, and please put your systemic history first, beside going towards your family or the socioeconomic history. So you have to give your like short the complaints, but the problem, it looks like a problem list, huh? Because in the systemic review there were problems. So you have to highlight those problems, okay? Otherwise, it's a known case. Repeat your
Mhm.
summary and try to improve on them.
Abdullah, his known case of asthma was diagnosed 2 years back, and with the asthma, that time he has to be hospitalized in the ICU. And now he's presented with the repeated exacerbations for the last 3 to 4 months, with having the repeated cough episodes with sometimes breathing difficulty. And he has a recent weight gain and having the bad eczema also. Uh, he's using his inhaler on his own, and mm,
Yes, yes,
there's
try to
family history of
complete. Yeah, yes.
there is family history of asthma and allergies, and the mother is having the asthma. And this condition is affecting him, the social life and the academics. Uh, he's living in a well-ventilated house. Otherwise, there is taking care for to avoid the triggers. But he
So,
loves pets.
yeah, but see, the examiner already listened to your history. So, if you are again detailing the
Mhm.
same points which you already listened, then what is the purpose of the summary? So, summary should be very nice, and it should put the main problems on him, like why you are discussing the case with him, consultant. Okay, he should know about what's
Mhm.
the problems. Otherwise, he have to take the whole history from the parents. So he should know the problem. So 14-year-old Abdullah, known case of asthma since the age of 2 years, currently present very frequent exacerbations associated with okay, so weight gain. What else was that? Some kinds of burnings and some kinds
Gastritis,
of, yeah,
this summer.
gastritis, or maybe you can say about the bloating and burning sensations in the heart, these kinds of feeling he's having. He's compliant on medications, okay, and there is no history of hospitalizations other than at the time of diagnosis, okay. Other than this, he's born to a non-consensuous or consensuous marriage. There is a family history of mom being allergic, suffering from eczema, okay, and there are no history of pets or smoking in the family. Okay. That's you are describing about the family. Then comes the socioeconomic. So Abdullah is from the history you get that Abdullah is facing some kind of a psychological impact of the condition, and he's going to school and he's facing a psychological impact of this chronic condition. Though he's good in his studies and he's following the compliance. So you have to mention, break your history and try to highlight the problems. If you are highlighting it only like Abdullah is a known case of asthma, diagnosed at 2 years of age. When he was admitted in ICU, it means you are going to the chronic history. He wants to listen what are the problems in the history which you have to focus. So now he's coming with you with the frequent exacerbations and associated weight gain and gastritis, symptoms of gastritis. Also, he's having a kind of a psychological impact of the condition because he's going to school and maybe there is some kind of bullying issue, though you didn't took the history on that ground, like is there any bullying issue, because that is also very important. Okay, what is the psychological support he's
Mhm.
getting? So you have to mention the positive thing, don't describe the whole history. Okay, what are the positive things in your history, you have to mention it. So now you have to describe it, try to do it once more in your own words, just summary of 3 lines, and do it in a systemic way. HOPC, then go into the past or birth or family. Okay, and then comes the socioeconomic in the end.
14 years old Abdullah presented with the acute exacerbation of the asthma for the last 4 months that is associated with some weight gain and some
Frequent
gastritis
heartburn,
and
yes.
frequent heart pain, heartburn. And he has also known case of having the bad eczema
Okay.
and is diagnosed with the asthma at the 2 years of the age, and he's taking the medicine by on his own, and the disease is affecting his social life, and
Okay.
there is family history of eczema also.
Okay, okay, now better. Okay, so try to practice it. We will do it. It's easier. But you know, there are lots of history. There is a lot of information in a chronic history. So how to put it together, it will not happen in just one day. It will improve on practice. What is a chronic history? There is a lot of information you get, and you have to put it nicely in 3, 4
Mhm.
sentences for the examiner. Okay, so what do you think?
And
What are the causes?
causes may be the compliance or maybe the most probably the compliance because he's taking by
So
himself.
did you check what are the doses of medications which he is taking? If I ask you what are the doses of steroid, is he on medium or low dose or high dose of steroids?
Mm,
He's a known
no, I
case of
didn't check.
asthma. Hmm.
Uh, that
So
I
that
didn't
is
ask.
important. Yeah. So you have to ask. I
Okay.
don't know, you ask about the oral steroids, but oral steroid will, that's also a question. But what about his current medication? Currently, he's on inhalers, right? So what are the dose of
Mm-hmm.
inhaler steroid he's taking and how many times recently? Past 1 year, she will not remember, but recently, how many courses of steroids he's taken? Because he has frequent exacerbations in the last 3 to 4 months.
Mm-hmm.
Got it?
Yes.
So that is an important
Mm-hmm.
information. How many courses of steroid recently he's taken, because this is the exacerbation. The other thing is whether he's compliant on that. What are the medication doses he's receiving? Okay, and this can be one factor that can be causing his symptoms. So you have to clearly ask about this. So do you think like sometimes he forgets to take his medications on time? Otherwise, how will you check the compliance? You just ask like, is he taking his medication or not? Okay.
Yes.
So even in a communication
Yes.
scenario, you cannot ask a direct question, right? Like you're judging the
Mm-hmm.
parents or the teenager. You will ask, do you think like in a modest way, do you think like sometimes he forgets
Mm-hmm.
to take his medications? Okay. So that's why you have to ask the
Yes.
question like this. Then the medication doses. So one issue will be the compliance. What are the other issues for the exacerbation?
Then maybe the dose is not appropriate.
Okay. What else?
Dose is, or some stress factor mm, is
Okay.
there,
So what about the
and
complaints? Why he's like, do you think you have to deal with his triggers as well? Like he has kind of a maybe reflux and he's obese as well. So there are underlying triggers are present, right?
mm,
So that is important, no? Before you will move on to checking his, you have to improve the triggers, like if he's compliant or whether they are associated some comorbids as well.
Yes,
Yes, so that is the reason of his
perfectly.
exacerbations. Okay, so it means if you are being
Oh,
giving a known case of a certain condition, they wanted to ask, like, if it's a case of cystic fibrosis, is he developing some other comorbids? That's why the disease is not being well controlled. Okay, so in chronic condition, there are lots of things that you have to take care of that. Madhya, would you like to add on anything on the history part?
So, same things as Shumaila has mentioned. Make sure that empathy is incorporated, at every step. At least 3 to 4 times, you should show that you are really empathetic to the mother, okay, or the role player. And again, I think the questions of past history you asked before the systemic inquiry. So I think once you started, okay, describe his cough for me, and the mother described, so you could have asked, so when and how was he diagnosed? That was one question. You did not ask how was he diagnosed. So you asked when was he diagnosed? He was diagnosed when he had a severe breathing difficulty. How? What investigations were done? You could have asked. Okay. So,
mhm.
is just a clinical diagnosis or a pulmonary function test was done or not? So that was one question. And I think after that, you could have completed your systemic inquiry quickly. And once you
Okay.
were done with the systemic inquiry and you entered into the past history, there all your questions. Okay, so mom, can you describe me what had happened initially when he was diagnosed? Okay, so she would have given you. Then, if you had not asked the question of, how, what investigations were done to diagnose, you could have asked, okay. Rest, I think you asked about the use of spacer. So he was not using the spacer. Compliance, you should be, as Shumaila mentioned, you have to, mention it that he's
Mhm.
a boy, but there is a possibility he might be missing some of the doses. So do you think that this is happening? Okay. And then symptom diary, you asked. Peak flow meter, you did not ask. Peak flow
How
meter.
we will ask this peak flow meter? What question will be there?
You ask, are you doing a peak flow meter monitoring for him? And are you maintaining its
Okay.
records? Okay. So generally they are doing it. Okay. So they are aware of it. Okay.
Okay.
Then I think last PFTs you asked, and number of oral steroid courses also you asked, and what current medications he's on is very important. Okay. So what current
Mhm.
medication he's on, and uh, again the doses also you can ask. Okay. So I think that part you could have included in the past history, so it would look more systematic. Okay,
Okay.
all what you did
Sure.
was not wrong. It was also fine. Okay, but I think once you are taking the current history, so you can inquire the other things quickly, and then in the past history, you can go into the details of it. So, is he following any teams? I think you did not ask for the team.
Mhm.
You asked